Tonight, we turn our focus to what has been referred to as a silent epidemic. Every year in the United States, 2 million people sustain a traumatic brain injury. This is 1 every 15 seconds. TBI, or traumatic brain injury, is referred to as silent because so many people have no visible impairment after an injury. Instead, the results of injury can show up in changes in cognitive functioning, communication style, even social and behavioral disruptions. Invisible disabilities are often more difficult to identify, as we have examined in earlier shows on learning disabilities and chronic pain. However, identification has become particularly relevant in Santa Clara County, as the Traumatic Brain Injury of California has been lobbying to require specialized training for law enforcement officers to more readily separate disability from criminality. Failure to know the difference has resulted in more than one tragic and unnecessary death. With us tonight is Terry Stimson from the Brain Injury Association of Northern California. She's a clinician, an activist, and a specialist in identifying the needs of the brain injured. And I want to welcome you, Terry. Thank you for making time to come.
Thank you for the invitation, Mary.
Now, I know that you're here, though you provide services for people in terms of, in your private practice, in terms of case management. I know you're here tonight representing the Brain Injury Association. And this, now I said Northern California, but I have a feeling it's all of California.
It's the Brain Injury Association of California, formerly referred to as the California Head Injury Foundation, but we've changed the name.
Okay. Now, one of the, as I was doing the research and preparing for tonight, I was struck with how many different ways injuries can happen. Mm-hmm. And so I thought what we do is talk a little bit about the formal definition of this. And I know you have the most updated definition, and you can tell us about, you know, what exactly is it, and then we could talk about how it happens.
Good.
Okay?
Well, I will first say to you that there's a classification of brain injuries referred to as acquired brain injuries, of which trauma is one of the categories. Others that are more commonly understood refer to like infectious disease, like meningitis or HIV, or herpes encephalitis. We also could have stroke, seizure disorders, metabolic disorders. There's a whole range of subcategories that fit into the acquired brain injury classification. But the focus historically for the Brain Injury Association has been trying to address the needs for both medical care and long-term care support services for those people who have traumatic brain injury as a result of being in a vehicle collision, perhaps a gunshot wound to the head. In the official definition, actually, for the Brain Injury Association that describes traumatic brain injury as any insult to the brain that's not of degenerative, congenital nature, but caused by an external physical force. Okay. And it may produce diminished impairments, like altered state of consciousness, may result in some impairments, cognitive abilities are impaired, or physical functioning may be impaired. Maybe temporary impairments, may be permanent, lifelong problems.
Yeah, I was struck with that when I was doing the research that I have an interest in learning disabilities in general, and when you start to look at this, you know, how I think the key to this definition is acquiring through external force.
Correct.
So I think, you know, when we're talking about something, we're talking about it being very important to know somebody's history, because a lot of the symptoms we're about to look at, I've also seen in other areas. So that's why it's particularly important to have somebody of your specialty can help us sort of weed that out. Let's take a look at the first set of symptoms somebody might have who has suffered a brain injury or brain trauma. The first is changes in maybe their speech, their vision, hearing and other sensory impairment, headaches, lack of fine motor coordination, spasticity of muscles, seizure disorders, and then balance impairments. And I have those in front of me as well. So it looks like even if I can identify that somebody's had a brain injury, I can't see it. The person who suffered it apparently would be quite aware that they're having these kinds of difficulties, I mean, from the inside. What kind of changes in speech and vision and that sort of thing do people suffer?
Sometimes an individual may have slurred speech.
Okay.
They may have problems with word finding. They may they may say somebody's last name if it sounds like it's a first name, for example, Thompson or Thomas. If that's somebody's last name, they may refer to the person as Thomas and as a first name. Okay. There can be problems with vision, blurred vision, double vision, field cuts. Some may, depending on the site of the trauma, may lose their sense of taste, sense of smell. There could be ringing in the ears. Okay. Some may have, this is more true at the beginning of the injury, nauseousness, dizziness. That passes, that tends to pass with time. Of course, seizure disorders, as you mentioned, for some that requires medication, either as a way of preventing it if there's the potential, or controlling it if there's a history.
So some of this really depends on, as you mentioned, what part of the brain lobes we're talking about here.
Depends on not only the site, but the severity of the impairment. Because brain injury is classified on the continuum from mild to catastrophic. And mild doesn't mean there aren't consequences. And actually, statistically, they say about 80% of the people with brain injuries do fit in the mild category. Often referred to as concussions. People have had a concussion. Steve Young, for example.
Yeah. Okay, so actually what's striking me is I work primarily in chemical dependency treatment. And I see an awful lot of people who have had fallen off their motorcycles, have been in bar fights, gang fights, who've been hit in the head at some point. I mean, there was a gentleman I saw the other day who had been shot in the head at 16. But a remarkable number of people never ever get any treatment. It's sort of like they say, well, yeah, I fell off my motorcycle and hit my head when I was 17, but no, I didn't see a doctor. I just sort of, eventually I felt better and that was it. So weren't really aware. I guess they would be in the kind of moderate to mild, in the sense that they weren't aware of any major trauma happening to them.
Well, the connection wasn't made to them. A perfect example, a 16-year-old was in a motorcycle crash, was in coma a couple of weeks, actually had no recall of his life. He had significant post-traumatic amnesia, and got through school, never identified himself as having traumatic brain injury, but had seizures and thought he had epilepsy. That's how he defined himself. Okay. And also had a substance abuse problem, and had difficulty accessing services because, one, of the seizures, and two, well, they were concerned about whether or not he could get benefit from their programs. Okay. He himself had never really been seen by a comprehensive team of professionals that, one, could not only provide the diagnosis in a way that brought him to better treatment resources, but that he understood, or that his family, those around him, understood the level of difficulty he had. And through his life, because of the problems, he resorted to alcohol as a way of escaping. And so sometimes you can't always rely on the information the individual has about their history as being able to define what they need. And it's really important that people in your position are better able to recognize the characteristics, either by review of history, a good point, car crash, motorcycle crash. Perhaps there was some trauma to the head. It lets you probe and ask more questions, and you can then ferret out what it is that the individual might need in order to be successful in their treatment program.
Well, and what you're bringing up too is, again, the person themselves may not have even made that link. Let's take a look at the next set of symptoms we have, which is more along the lines of cognitive impairments. Okay? We have short and long-term memory deficits, impaired concentration, slowness of thinking, limited attention span, impairments of perception or communication, reading and writing skills, planning, sequencing, and judgment. Now, the first thing that strikes me when I look at that list is I'm also could easily be looking at somebody who's under the influence, or who's in detox, or who is, you know, has been using drugs for a period of time. Let's say PCP. I mean, they have like the majority of these. So, again, it speaks to really sitting down and knowing what questions to ask to sort that out, doesn't it?
It does, and you know, when people are slow in processing information, or who may have slurred speech, or may have double vision, somebody who doesn't really know what's going on with the individual, or they themselves don't know, may feel, yes, they're under the influence. And sometimes it makes a difference between whether or not somebody gets into treatment or not. And it's really important to understand that there are these physical and also the cognitive impairments that result from trauma to the brain, and it's further complicated when you're abusing or using alcohol or other, you know, substances. You know, people may have poor insight about their problems. Oftentimes, it may be described as they're in denial, but there is a lack of awareness about the deficits, and that's part of the injury.
Huh.
It's part of the injury, and I don't quite look at that as denial.
Right.
I look at that as a consequence of the injury, and so a way to assist people in better understanding the relationship of the problems they're having is to work with them for a longer period of time, give them more time, give them information, be more flexible in your approach about how you're giving information to them, so that they have enough time to absorb it, to digest it. Repetition is helpful in remembering things.
Okay. Well, and what we're going to do is have to take a break here in a minute, but so it looks like part of the diagnostics requires time. This is not something I can just sit down with you and instantly know that there is a brain trauma, particularly if you don't even know.
Correct.
Okay, which is why you're a specialist. Okay. Well, stay with us. When we return, we'll look at progress in law enforcement training and get more clear about the emotional consequences of this kind of injury. Okay, welcome back. When we left, we were talking